You strap a loud, uncomfortable mask to your face every single night. You feel claustrophobic, your mouth dries out, and you constantly worry about the hoses getting tangled. You hate your CPAP machine, but you use it because you are terrified of stopping breathing in your sleep. But what if I told you that your CPAP is only a band-aid, and standard medicine is completely ignoring the real reason your airway collapses? Today, we are exposing the root cause of sleep apnea. This video is for educational purposes only. Severe sleep apnea is a life-threatening condition that can lead to heart attacks and strokes. Never throw away your CPAP machine without consulting your sleep specialist. The therapies discussed here are adjuncts to help you strengthen your body, not immediate medical replacements. If you feel frustrated, embarrassed, or even resentful toward your CPAP, you are not alone. A lot of people start with hope and then reality hits. The mask feels unnatural. The airflow feels strange. The straps press into your face. You wake up dry-mouthed, tangled in tubing, and wondering, is this really my life now? And for many people, the answer is painfully honest. They stop using it. Not because they do not care. Not because they are careless. They stop because sleeping with a machine attached to your face can feel like surrender, not healing. Inside sleep medicine, there is an uncomfortable truth. If a treatment only works when you can tolerate it perfectly every single night, it is not solving the deeper problem. It is managing the crisis. And that is why so many people abandon CPAP. Not because they are weak, because the experience feels unnatural, because nobody wants to live forever with a plastic barrier strapped across the face and a hose attached to the bed. Here is the key idea that changes everything. Doctors use CPAP to save your life today, but that does not necessarily mean the airway itself has become strong. CPAP can keep the airway open while you sleep, but it does not teach the airway how to stay open on its own. That difference matters a lot. So tonight, before we talk about exercises, tongue posture, and why the throat collapses in the first place, I want you to hear this clearly. Your frustration makes sense. You are not crazy for hating the machine. You are not failing because it feels invasive. You deserve more than just being told, wear this forever. You deserve to understand why the airway collapses and what it takes to build real support from the inside out. That is where this story gets interesting. Now let us get to the real question. Why does the airway collapse in the first place? Because sleep apnea is not just a noise problem. It is not just about snoring. It is not a random glitch. In most cases, it is a mechanical problem happening inside a very small space, your upper airway. And when that space becomes too narrow, too soft, or too unstable, breathing becomes vulnerable the moment the body relaxes. When you are awake, your brain is actively helping your airway stay open. Your tongue has tone. Your throat muscles have tone. Everything is working in coordination. But when you fall asleep, that muscle support naturally drops. That is normal. Sleep is supposed to be a relaxed state. The problem is, if the airway is already narrow or the supporting muscles are already weak, that normal relaxation becomes enough to create collapse. Here is the part most people never get clearly explained. Your tongue is not just sitting there passively. It is a large muscle, and it has real weight. When the tongue is strong and resting in the right position, it supports the airway. But when it is weak, low, or poorly positioned, gravity can pull it backward during sleep. That backward movement can crowd the throat and reduce airflow. For some people, that means snoring. For others, it means partial obstruction. And for some, it means repeated pauses in breathing. The throat is not a rigid pipe. It is a soft, collapsible passage made to stay open with the help of surrounding muscles. That means the airway depends on stability. If the soft tissues are lax, if the jaw position is unfavorable, if the tongue posture is poor, or if the airway anatomy is naturally small, then the whole system becomes easier to compress. Think of it like a soft straw being gently pinched from the outside. It does not take much pressure to reduce the flow. This is where CPAP comes in. CPAP stands for Continuous Positive Airway Pressure. In plain English, it blows air into the airway so the passage stays open. That is why it can work so well. It is acting like a pneumatic splint. It is holding the airway open from the outside with pressure. And that is also why it is not a cure. It supports the airway while you sleep, but it does not train the tongue, the throat, or the surrounding muscles to become stronger on their own. So the root cause is not simply you breathe badly at night. The root cause is often that the airway lacks enough muscular support to stay open once the body goes into sleep mode. And once you understand that, you start to see a very different strategy. Instead of only forcing the airway open from the outside, the real question becomes, how do we strengthen the system from the inside? Now we have to be careful and precise here. The real point is not that CPAP is evil or that it damages you by itself. The point is that CPAP is support. It is not exercise. It is not resistance training. It is not teaching the airway muscles to become stronger. In muscle biology, there is a basic principle. Tissues adapt to the demands placed on them. When muscle is repeatedly unloaded, it can lose strength and size over time, which is why resistance exercise is used to help prevent or reverse disuse atrophy. That principle matters here, because a nightly machine that stabilizes the airway is not the same thing as a nightly program that trains the airway muscles. Think about what CPAP is actually doing. It uses continuous positive pressure to splint the airway open, which is why it can be so effective while you are wearing it. But that external pressure is doing the stabilizing for you. It is holding the passage open from the outside instead of asking the tongue, soft palate, and surrounding airway structures to maintain their own tone against collapse. That is why the atrophy conversation is really about conditioning. The genioglossus, the major tongue protruding muscle, is one of the key upper airway dilator muscles. An upper airway muscle tone is part of what helps prevent collapse during sleep. When those muscles are not being actively trained, you are not building the kind of tone and coordination that helps the airway stay open on its own. That does not mean every CPAP user is becoming weaker in a dramatic or uniform way. It does mean the machine is not a muscle program. It does not retrain tongue posture. It does not strengthen the soft palate. It does not automatically improve the neuromuscular response that keeps the airway from collapsing when gravity and sleep relaxation kick in. That is the trap. Symptom control can be mistaken for root cause correction. So the goal is not panic. The goal is perspective. CPAP can be life-saving support, but support is not the same as rehabilitation. And once you see that difference, the next question becomes obvious. How do we train the airway so it depends less on the machine over time? Now we get to the part most people have never been taught. There is a real therapy model built around retraining the muscles that help shape breathing, swallowing, and tongue posture. It is called myofunctional therapy, or orofacial myofunctional therapy, and it trains the muscles of the mouth and face to move and rest in better patterns. Cleveland Clinic describes it as exercises that strengthen these muscles and improve awareness of facial movement. This matters because the tongue is not a passive object. It is a powerful muscle that can either help support the airway or contribute to collapse when it sits too low and too relaxed. In fact, Cleveland Clinic notes that, at rest, the tongue should be lightly suctioned to the roof of the mouth, not parked on the floor of the mouth. That is the paradigm shift. Instead of only splinting the airway from the outside, you begin training the inside support system. Small, targeted exercises for the tongue, soft palate, lips, and jaw are designed to improve muscle tone and coordination. That is why myofunctional therapy is often described as training the muscles to move as they should and rest in the proper positions. And this is not just theory. Reviews of the research suggest that myofunctional therapy can reduce apnea severity, improve snoring, improve sleepiness, and raise oxygen levels in some patients. A 2014 systematic review and meta-analysis found adult AHI fell by about 50% on average, with improvements in lowest oxygen saturation, snoring, and daytime sleepiness. A 2024 meta-analysis also found benefit in adults with obstructive sleep apnea. There is also evidence that therapy can improve tongue strength and tongue posture at rest. A clinical study in children found that orofacial myofunctional therapy significantly changed tongue elevation strength, resting tongue posture, and tongue position during swallowing. That is why this is so encouraging. Myofunctional therapy does not ask you to ignore CPAP overnight if you still need it. It asks you to start building the support system that CPAP never trains: posture, tone, and coordination. In other words, you are not just managing the airway anymore. You are teaching it how to behave better. And for many people, that is the first real step toward a more natural night's sleep. So here is the practical takeaway. Do not rush to throw away your CPAP. If your sleep specialist prescribed it, there is usually a good reason. And for severe sleep apnea, it can be a critical safety tool. But at the same time, do not let the machine become the whole story. The machine supports the airway tonight. What we want to address is whether the airway can become more stable over time from the inside out. That is where myofunctional therapy enters the picture. Clinical sources describe it as a way to retrain the lips, tongue, jaws, and related muscles to work together more effectively. And evidence reviews suggest it can improve OSA-related outcomes as an adjunct in many patients. Think of it this way: if your body is out of shape, you do not fix that by only wearing a brace. You also train the weak system. That is the philosophy here. The throat, tongue, and soft palate are not random tissues floating in space. They are muscles and support structures that can be trained, coordinated, and conditioned. A comprehensive airway exercise protocol is meant to build better tongue posture, stronger oral tone, and more reliable airway support during sleep. That is a different strategy from simply inflating the airway open from the outside. And this is where people often feel hope again, because the goal is no longer, how do I tolerate a mask forever? The goal becomes, how do I improve the way my airway functions? That is a much more empowering question. A structured program can give you a simple daily routine: tongue exercises, soft palate work, and posture retraining that fit into a few minutes a day. That kind of consistency matters because the airway does not change from one dramatic intervention. It changes through repeated practice, just like any other muscle system. So if you have been searching for a clearer path, a reasonable next step is to look at a comprehensive airway exercise blueprint that shows you exactly what to do each day in plain language without the confusion. Not as a replacement for medical care, not as a miracle claim, as a disciplined, root-cause-focused training plan that may help support the airway while you continue to work with your clinician. Always consult your doctor before changing sleep apnea treatments, especially if you have severe symptoms, cardiovascular disease, or are still adjusting to therapy. The safest path is to treat CPAP as protection while you build your airway capacity in parallel. If you want a structured place to begin, check the link in the description for the airway exercise blueprint. And remember, the real goal is not to fight your body. The real goal is to retrain it. Closing disclaimer. This video is for educational purposes only. Severe sleep apnea is a serious medical condition. Do not stop or change your treatment plan without speaking to your sleep specialist or physician first. The exercises discussed here are adjunctive support, not immediate medical replacements.